mynews.studio.
There's a lot of hope riding on a single syringe for HIV prevention and for offering another option to people with leukemia. But the real question is whether these advances will actually reach everyone who needs them.
Today's date is July 28th, 2025. Let's get straight into it. Can you walk me through what's different about these new leukemia and HIV prevention treatments?
Sure, for leukemia, there's a new investigational drug called ziftomenib. It's aimed at acute myeloid leukemia, but only for patients with a specific genetic mutation. What stands out is how well it's working in clinical trials. The responses are not just strong, but lasting. That's a real departure from older, less targeted chemotherapies. And on the HIV front, the World Health Organization has just recommended lenacapavir. This is an injection you only need twice a year, yet in trials, it's prevented over 99.9% of infections.
Hang on, a shot every 6 months instead of taking pills every day? That could really change things, especially for people who have trouble keeping up with daily medication routines. But what about side effects? Do these new drugs come with fewer risks, or is there something new to watch for?
So far, the early data is encouraging. For ziftomenib, the side effects seem to be more manageable than with traditional chemotherapy, though the trials are still underway, so we don't know everything yet. Lenacapavir mostly causes mild reactions at the injection site, things like soreness or redness, nothing severe in most cases. But there's another layer. Both drugs are expected to be expensive at first. That could make it difficult for many health systems to provide them widely.
That brings up the question of cost, especially in countries where resources are already stretched thin. Is there any sense yet of how big a barrier price will be? Will these treatments actually be accessible, or are we risking a bigger gap between those who can get them and those who can't?
That's really the core issue. The costs are substantial. Ziftomenib isn't just the medication. It also needs specialized facilities and trained professionals to administer it. Lenacapavir, meanwhile, depends on a reliable supply chain for the injections and regular, rapid HIV testing. And with recent global funding cuts, like those to PEPFAR, it's even harder for many countries to roll out these programs.
So it's not just about having the drugs. Infrastructure, regulation, and staffing all come into play. Is anything being done now to tackle these hurdles?
Yes, several things. The World Health Organization is pushing for lenacapavir to be rapidly included in national HIV prevention programs, focusing on areas where risk is highest. They're also recommending simplified testing and more community-based delivery to make access easier. For leukemia, they're working to expand clinical trials to include more diverse populations and different settings, so the data is relevant to more people.
But even if those measures work, there are still ethical concerns. How do we make sure people understand what they're signing up for? And what about privacy, or making sure vulnerable groups aren't taken advantage of as these new treatments are introduced?
That's a big focus for WHO and its partners. They've updated the guidelines for informed consent and are making sure communities are genuinely involved in the rollout. The goal is to build trust and deliver these advances with equity, not just drop them into a community without engagement. There's a real risk that without that, these breakthroughs could actually deepen existing inequalities.
Another development that came up is early dementia detection using blood tests. How does that fit into this broader health conversation?
Blood tests for early dementia detection could really change how we approach neurodegenerative diseases. If we can diagnose earlier, that means a better shot at slowing progression and supporting families. It's a different kind of breakthrough, but potentially just as impactful for health systems and caregivers.
So looking at the whole landscape, we might soon be able to tackle cancer, infectious diseases, and dementia earlier and more effectively than ever. The science is there. Now the real challenge is making it available to everyone, not just a few.
Exactly. The measure of success for these innovations will be how widely they're delivered, not just to those with money or access to top hospitals.
That's the recurring theme here. Scientific progress can open the door, but it's policy and funding that decide who actually walks through.
And as these treatments move from research labs into real-world clinics, the global health community is watching closely. Will we see millions benefit, or will the same barriers keep holding people back?
That's our deep dive for today. New options for leukemia, HIV prevention, and dementia detection could reshape global health, but only if we face up to the challenges of access and equity.
Thanks for tuning in. This episode was powered by mynews.studio. You can try it now for free.